Hey, Dr. Starr. Thanks so much for taking the time to do this interview.
Sure, anytime. Come on
All
in, have a
right.
seat.
Thanks. Well, let's just dive right in. Tell us about your profession and the major subject area that you teach about.
All right, well, I teach in the MACC program, which is the Master's in Arts of Clinical Counseling. So it's really teaching people how to counsel. Currently, right now, I'm teaching actually a couple of classes on the spectrum. I teach a couple I take the ethics course, which is an introductory first year course, and I also teach internship 2, which is one of the last courses. So it's kind of fun to get students on both ends of the spectrum, and then I do a couple in the middle with research or assessment. So I kind of landed with those courses currently. I have a background in education, and I actually have a background with doing a lot of work with adolescents, a lot of personality work, a lot of work in and around people developing spiritual identity, sexual identity, social identity, a lot of marriage and family stuff. I currently have a private practice down in Narvon, PA, which is a little south of Reading. I've been here about 3 years. Married with 3 children, 3 daughters. 2 are now married. 1 is still at home. I have 2 dogs. Somehow we ended up with huge dogs. I have Great Danes, which are ridiculously large dogs. In the summer, I golf and cycle, and in the winter, I snowboard. I currently am working on a number of certifications. Like I said, I started in education, so I do have an elementary ed degree, a special ed degree, as well as certified as a school counselor, which I love that. It's the adolescent world. I really am an adolescent fan. I think there's a lot of work to do. And I think primarily because if you work with that population, some of the issues in adulthood can be not nullified, but negated a little bit if you get some of that worked out. The counseling industry is kind of relatively new when you compare it to some of the other mental health professions like psychology or even medical field or even social work. So there's some very distinct differences, but yet sometimes they get a little confused because they're very subtle, but yet they're different. For example, one of the big ones that gets the most confused is probably counseling and social work. And in a lot of ways, they are similar. When you're a licensed social work, you can counsel. But one of the main differences is that typically social work focuses more on the physicality of the client. Are they warm? Are they safe? Are they dry? You know, that kind of like the basic layers of Maslow's hierarchy, and just some of the physical needs. Now that's being a little harsh, but just to make a harsh comparison. Whereas counseling would more work off of some of the psychological, and even more than to draw a distinction from, well, that was a psychologist do. A psychologist assesses or tests typically the day-to-day functionality, whereas a counselor kind of works with the individual on more of a I don't want to say just a practical, but more of a day-to-day, which is why one of the theories we go by is called cognitive behavioral. How you think impacts the way you behave. So that's just kind of on a day-to-day processing issue. So that's probably one of the biggest distinctions between those. The other real big distinction is that in social work with an undergraduate degree, you can go out and work in the field. Counseling, there is no such thing as an undergraduate. You need a master's to work in the field. And a psychologist, you need a PhD to work in the field. So those are, now you can get a PhD in all 3, but that's really some of the kind of biggest distinctions. And actually, in the psychology and counseling world, the distinction between a counselor having a master's and then getting a license versus a psychologist requiring a PhD has some friction between those two worlds. And that's where the APA, the American Psychological Association, and the ACA, they're on more friendly terms, but the APA has been around for, let's say, I don't know, upwards of 100 years. And the ACA has really only been around since like the late 60s, or even late 50s, early 60s, somewhere around there, where they really started to look at counseling as a separate entity. And then counseling as a whole over the past, what is that, like 40 years, 50 years, has started out from saying, really, what are we and how are we distinct from social work or psychology? And so The ACA has done a really good job in encouraging like licensure for counselors, distinguishing counseling from like pastoral counseling, and again trying to distinguish it from the psychologist, which again would predominantly do the testing. Counselors don't do a lot of testing, and the social worker, where counselors don't do a lot on helping people find health care, for example. The income potential job outlook of counselors right now is phenomenal. It just depends on what you want to do and really how quickly you're able to get licensed. Licensed is the ability to bill insurance, and in PA currently, you can't counsel or be a counselor unless you at least have a master's degree and then work for someone or with someone or are supervised by someone that has their LPC, that they're a licensed professional counselor. To become an LPC, you need your master's, you need 60 credits, and you need certain categories, which being KCREP is one of the governing bodies of the counseling world. Alvernia is a KCREP accredited program, meaning we follow the KCREP guidelines of what courses should be taught, the order they should be taught in, how many credit hours, what should happen in those courses. So then once you complete your master's program, it usually takes people somewhere about 2 years to be licensed. There's several phases to it. The one is you have to pass the National Counselor Exam, so the NCE, and that's independent. The other kind of two pieces are you need 3,000 client hours, so direct client hours, and 150 of those kind of need to be face-to-face, or sorry, 1,500 need to be face-to-face. The income potential from there is it's pretty good. I mean, right now, most counseling centers are experiencing a backlog, especially with COVID. And that's not going to go away anytime soon. You know, there's a hope that mental health will be taken a little bit more seriously. I think just recently we started to allow people to express mental health issues and have that be okay, instead of just calling them crazy or wacky or nutty or whatever terms that are slightly derogatory. One of the dilemmas is that currently each state has its own rules about being licensed, and they're not that different. But currently, I'm licensed in PA. I couldn't go to Delaware and counsel. I would have to reapply for approval in Delaware. Certain states, it's not that big a difference. Some states, it's a huge difference. It's one of the things that the National Board of Certified Counselors, or the NBCC, is trying to nationalize licensure for counselors, so that, especially now with COVID and a lot of teletherapy, which is doing therapy via Zoom or the internet, the biggest question is, if I'm in PA but my client is in Ohio, which state holds the governing rights for how we interact? Legally, they wouldn't be able to counsel if someone was not in the same state.
Okay.
But they're working to change that, because predominantly for military, for example, it's probably one of the differences from really any other major, maybe not all, but most, in that, you know, we actually have an ongoing engagement, and it kind of it keeps you fresh, because that way when I'm talking to students, I have constant like new examples to use, new ideas. It's keeping me sharp. It's one of the things that's hard about finding professors, because most people don't want to move after they get their PhD, because they already have a client base, so they want to teach close to where their practice is, because that's where their home is. Yeah, that's one of the things that you know really you would learn and talk about after you get a job, because like I mentioned, in PA you can't have a practice on your own without a license, so you need to work for somebody for 2 years to get your license. um, and so yeah, you one of the things is just in some ways just putting your name out there, contacting schools, contacting local physician groups, so that they, you know, have someone to refer if someone comes in and they are presenting with anxious or depressed symptoms. Churches, because a lot of people still, at some level, when the, if you will, when the chips are down and life is hard, will go to, you know, a spiritual advisor. So whether it's a synagogue or a mosque or rectory or church, you know, wherever you are in that spiritual spectrum, or sometimes just word of mouth, or there's different places to advertise depending on what you specialize in that people will Google.
If a student comes in and they aren't sure if they want to go the psychology route or the counseling route, what advice would you give to them?
I would ask them whether they want to do more assessing or more client interaction. A psychologist does more assessment. That doesn't mean they always do only testing, but predominantly they're assessing the client's functionality. Whereas a therapist is dealing more with the day-to-day processing of that functionality. So a lot of people ask, like, okay, I'm going to get this degree, what can I do? Currently, the way most programs are is that you become what we would call a generalist, meaning that the program doesn't say you're going to work with children, you're going to work with couples, you're going to work with elderly, so gerontology counselor. You can specialize in those. And there are specialties. For example, play therapy is typically oriented towards children. There's music therapy that you could do. There's art therapy. They require a separate certification that you can obtain after you become a counselor. So certified drug and alcohol counseling, for example. There's a test that you can pass. In PA, if you pass the NCE, you're considered a licensed counselor. You could take the certified drug and alcohol counselor test and then become an LPC. You could take, there's a marriage and family therapist test. You could take that specialty and still be an LPC. The generic one is the National Counselor Exam, which allows you to work with pretty much any population. Most people then specialize.
Does Alvernia have these specialized classes specifically for the different specialties, or is that something you do afterwards?
Typically, it's something you do afterwards. Okay. We've talked about adding in play therapy. The dilemma with students, and students ask that question all the time, the dilemma with everything, it's either time or money. So yeah, if we start adding on other certifications, it's great. It just takes longer, it costs more. So really the KCREP agreed upon model is, hey, here's 60 credits that you need, and this is pretty much the nugget, the core of the degree of what you need to be a professional counselor. And then there's a few years of experience, and then you start to specialize. Hey, I really want to work with this population, or I have a musical background, I want to incorporate that into my therapy, or I have a desire to incorporate play into therapy, and you can do that. And there's a lot of ways to do that. There's a lot of cool things out there that help people process thoughts, emotions, feelings that they weren't really even sure that they had, or that they knew they had, but they didn't know what to do with them or where they came from. For example, right now, a big one is reviewing trauma, and particularly childhood trauma. And it's just coming because people are realizing, hey, wait a second, like something happened and I'm having a hard time as an adult processing thoughts, feelings, emotions as I get older, or as I'm married, or as I have children. Where's this coming from? Unknown self-discovery is just part of the program. I mean, it's tough to, again, if you're going to be a doctor or a nutritionist, it's tough to not think about what you eat. So if you're going to be a therapist, it's tough not to think about how you think and how you feel. So there's a fair amount of self-discovery. I think the biggest question is, people say, will I be good at this, and will I be able to do this? Because I don't think people realize two things, how intimate it is as you share and engage with someone. The other thing is how subtle. Not every time that someone emphasizes a word does it mean something, but sometimes it does. So how do you know when it does and when it doesn't?